Hello and a big welcome to everyone who is participating in our World Health Organization webinar today. So thank you very much, and we have an absolutely brilliant jumper big session today, and the theme of this week's World Health Day is Stay Super, Eat Healthy and Beat Diabetes. And we have a couple of wonderful guest speakers who are on the front line in public health dealing with some of the rising challenges that we face. And so we're going to talk about diabetes in our case study, but we're also going to look at some of the other challenges that they're facing and how our public health program enables our students to face those challenges in the field. So without any further ado, let's go on and meet our wonderful panel for today. Our first guest speaker is Constance Shumba. Constance Shumba is a faculty member with public health and is currently studying for her PhD. We have Daniel Tom Arbour. He's also studying for his PhD at the moment, as well as public health student at the University of Roehampton online. And my name is Joseph O'Brien. I'll be the moderator today. So let's meet our guests. Hello, Constance. How are you?
Hi, Joe. I'm delighted to be part of this historical webinar today. Thank you for inviting me.
Of course. And can you tell our audience who may not know about your background just a bit about yourself, where you come from and what you're doing in the field of public health?
Right. Joe, I'm originally from Zimbabwe. My background is in health education and promotion, and I did a Master of Science in International Health and just submitted my PhD in International Health. I've been working in the field of public health for the last 13 years in the Africa region as well as in Southeast Asia.
Lovely.
And both of my experience is in addressing communicable and uncommunicable diseases such as malaria, HIV, TB, diabetes, road traffic accidents. It's really been a wide array of experience, including sexual and reproductive health rights for women and girls.
Okay, and that's great. And you're also teaching in our program. Congratulations for finishing your PhD. Where are you studying, Constance, for your PhD?
In Margaret University in Edinburgh, Scotland.
Lovely. And Daniel, hi, how are you? Hello, have we got Daniel on the line? Hi, Daniel, how are you doing?
Hi, Joseph. Yeah, I'm good. How are you today?
Very well. Now, you've got a very interesting background. A lot of our public health students and prospective students, working heavily in the field of healthcare, some of them doctors, hospital administrators and other people working within the industry. You have a very different background. Can you tell us a bit about your educational background and how you've ended up in public health?
Okay. I actually am from Nigeria, and my first degree was in statistics and computer science, and I have worked for over 8 years on software design, software development, and all that for about 8 years. And I had an opportunity to work with the United Nations for a short period. It was then United Nations Development Program, UNDP, as a data analyst, and that was my first time of actually seeing the value I could contribute to the health sector, because back then, it was a long time ago, in 2009, it was really crazy because health was not health was not in terms of data management, in terms of IT. There was nothing of the sort. You had people using Excel, doing paper documents and all that. So I had this drive to stick to, to redirect my focus from building softwares for the IT market, but then to see how we can solve public health problems. Now, not just public health problems at the time, but all health issues relating to patient management, public health and all that. But then I thought about a way of getting into public health, and then I came across the Roehampton about 2 years ago when I saw an opportunity to know how to solve public health problems, using the IT skills that I have. Basically, that's my background. That's how I came into public health. So I'm right now in public health, doing my master's in public health in Roehampton, and I'm almost done now, working on my dissertation. And my dissertation is actually on polio, how to look at the reasons or perception of parents about polio vaccines and all that. Yeah.
Okay, so we're going to discuss that thesis with you a bit more at length, as well as your role as a data scientist, because that's what you do now at the Helmholtz Center for Infection Research. Is you're a data scientist bringing your skills in IT to an industry that really needs your expertise. So I'm looking forward to discussing that with you. The lovely Constance has unfortunately fallen off the line, so I'm just going to quickly dial her back in, so please bear with us. We're trying to run a conference call across many continents at the moment, so just please bear with us. I do apologize as we just ring her back. Hi, Constance, are you there?
Yes, I'm here.
Hi, Constance. So, Constance, I want to talk a bit more about some of the work that you're doing in the field at the moment. You're coming from a very different perspective from Daniel. You're on the ground in many traditional advocacy role that many students will really relate to. Can you mention in more detail some of the issues that you're actually tackling and what you're doing to raise awareness about the current and rising issues in public health in your region?
Yeah, so my role is quite diverse. I mostly concentrate on training of health workers, building the capacity of health workers to address the challenges that we face as public health practitioners in the field. So most of my work is to do with developing tools and training health workers so that they can be able to cope with the public health challenges. Because you see, the WHO and other agencies give guidelines on how we should address the public health challenges we face. And that process of disseminating these guidelines to the local level needs some expertise, needs people like myself who can actually go on the ground and be able to train people on how they can actually deliver on the ground. But another angle is working with community to address communicable and non-communicable disease. And as you can see in some of the pictures I've given you, I was really on the ground because my view is that I should be able to really understand what challenges the community actually face, the circumstances under which they live, for us to be able to develop meaningful programs for intervention for our community. And as you can see, the current picture on the slide shows me in an urban slum in one of the poorest areas in Uganda. And you can see a child in a basin of dirty water. And all these are public health threats. For anybody who really understands the field, you can already start to see that this is jarring. We really have issues. So my understanding of public health as a person is, if I can respond to the challenges of that child sitting in that dirty water, of the child and the grandmother standing next to me, then I've done a good job.
Yes.
So really thinking about the global challenges, but really localizing it in our own context and saying, how can we respond at the local level in the way that we can? And for me, that is contributing to global health.
Yes, I mean, what I really liked here is that we have these two boys in lab coats, with the microphone, and they're acting out some scene, and I'd just like you to tell me a bit more about what they're doing here, some kind of role play. And when you gave me the photos, I had the tagline, role play about sexual reproductive health. So what are the guys doing in this photo, and how is that helping?
Right. So here we're celebrating a health day, and these children decided to act out a sexual and reproductive health skit. And what they were actually educating the audience about was teen pregnancy.
Nice.
So teen pregnancy in most of the urban slums are a huge problem because of poverty, and other vulnerabilities that children face. So these children are about 12, 11, and they were acting out, the consequences of failing to deliver health services to young people and how they can actually be affected by teen pregnancy. So this is what they were acting out in this play.
Thank you. Now, you've talked about a lack of knowledge in some of these areas, in rural areas, and spreading awareness through your advocacy work. How do you deal with the lack of funding that's there as well? How do you overcome such a lack of resources?
Right. Yeah, I think, when it comes to lack of funding, Joe, it's almost universal. I suppose it's the biggest challenge that everywhere in the world people will fight. But for me, I don't see it as an excuse for us not to deliver.
Of course.
I feel that, yes, lack of funding will always be an issue, but if we can respond to the issue at the local level in the best way we can, then we can make impact. And some of the interventions we need to be making at the local level do not require huge sums of money, but require us to be speaking, to be amplifying our voices, bringing our voices onto the table at the policy-making dialogues, bringing our voices to the table at the local community level dialogue so that our voices are heard and streamlined in the planning and policy processes. Because in most of these African countries, we have decentralized processes and there are mechanisms of citizen participation. And if we can encourage our citizens to participate in these mechanisms, then health will become a strong pillar in our African country and the world at large.
Okay, and thank you very much. And we already have some questions coming through, Constance, which is great, about how people can be enabled in their communities to do this work, and where is the focus, where are they needed. So we're going to discuss some of those issues later. So please keep your questions firing in if you want to know how you can be enabled to do the kind of work that Constance and Daniel do. Daniel, you've worked very recently with polio and developing some innovative solutions there and pushing things forward. Now, we see on the slide here, most countries are making good progress on preventable childhood illness. Polio is close to eradication. So I was very interested that you're still currently involved with work of this nature, and I was going to ask you, can you explain a bit to our audience today the purpose of your final research project for Roehampton, which I know is on polio?
Okay. The scope of my research has to do with countries that have more or less finished polio, in terms of not eradicating polio, but they've interrupted polio. So you have 1 year without polio. Parents have this idea, and they always make this mistake to confuse polio eradication for polio interruption. And it brings about a big problem, should I say challenge, when you have people saying, oh, I'm not going to vaccinate my child because I heard on the news that polio is gone. The truth is polio isn't gone yet. You still have to build the immunity of the child. You still have to vaccinate. As long as polio is in Afghanistan and Pakistan, even though Nigeria has been taken out of it, there's still a risk for any country to be infected. So my research has to do with what are the perceptions and the behavior of parents or caregivers in terms of accepting or refusing these polio vaccinations before looking at it before the country interrupted polio and looking at it after interruption of polio. So looking at what are the reasons for missed children, what are the factors that contribute to this different behavior and patterns, and it's really going to help the polio program. I've worked in the polio program for over 4 years, and I can tell you from where we are coming from over 122 cases down to 0 at the moment, and I can tell you that different interventions are put in place, and this also will contribute to that.
Okay, thank you very much. And what do you see, Daniel, maybe potentially as the solution to this kind of moving away from vaccinating? What do you think we can do to combat this?
Okay. I'll take one step backwards to say that when Ebola came into Nigeria, it was the polio structure. Those of us that were working on polio so far were sent to go and fight Ebola. And I'm trying to answer your question in this way because one of the things that helped us when we were fighting Ebola was we have communities here, different communities that have, okay, yes, you know that Ebola has struck. And then your question is, how do you enlighten the community about prevention? And how do you fight this kind of infectious disease, not from a preventive strategy instead of trying to fight the current disease? Reactive, yes. And so what we did was to try and boost social media, try and send information via Bluetooth, talk to people, enlighten people, do a lot of health education sessions, health education enlightenment programs, social mobilization, community mobilization, to let them know that you have to wash your hands, you have to not touch a sick person and all that. It helped, and we had to build different apps, that's from the IT point, build mobile apps out there for people to understand the need to stay preventive of the disease. Now, in polio, that's what we're about to do. Like for the research I'm working on, my recommendation is that we bring out ways we can enlighten the community that polio eradication is not the same as polio interruption. And for countries like Afghanistan and Pakistan that's coming to that phase of polio interruption, then they should be able to put in programs in place to change their message as epidemiology changes. If we come to that place of polio interruption, then your message should change as well. And when the people are enlightened, then you see the non-compliance rates going down.
Nice. I mean, there's a need for a middle strategy there between, a disease absolutely raging in a pandemic or to interruption phase and then to eradication phase and people not confusing one with the other, and there being a transitional phase that people still need to be careful and aware of in order to move closer towards eradication. So thank you very much for that, Daniel. We have lost Constance again. We're bounding across the continents here with our phone line, so I'm just going to quickly give her a ring, so just bear with me. I do apologize to our audience today. Okay, and we have Constance back. Hello, Constance.
Hi.
Hi. It's okay, we'll plod on, and this is exactly like the work that you do in the field. When things go wrong and you lost internet connection, you can't work on the field, you have to still carry on, and so we carry on today.
I do understand. I know the challenge perfectly. Yeah.
Exactly. So we're going to look at some case studies. We just discussed some rising challenges, and Constance, while you're off the line, Daniel was discussing, the difference between polio interruption and eradication, and the work that's still needed to be done to convince, mothers to vaccinate their children against diseases like polio, because in countries like Pakistan, Afghanistan, these diseases are still there. So this is a very important project, and that's what Daniel will be doing for his research project at Roehampton, Constance. So that's what he's working on. I'd like to talk to you, Constance, about diabetes, and as that is the year's theme for this year's World Health Day, and we're all told to stay super, stay healthy, and combat diabetes. For those that might think that it's a Western problem, I wanted to discuss diabetes in Africa. Is diabetes a public health challenge in the African region, Constance?
Oh, yes, absolutely. Absolutely. Diabetes is a major problem in low and middle income countries. I think the problem has been that historically we've always thought that non-communicable diseases such as diabetes, obesity itself, which means diabetes, have been perceived as a rich man's disease. And because of the poverty that's been associated with the continent, people always, it wouldn't affect low-income countries. But we're seeing a different trend. And in the last, the current statistics show that over 40 million people have diabetes in Africa. And by 2040, this number is going to, almost treble. And if we don't do something about diabetes now, we're sitting on a time bomb. So this, calls for us to reflect on our assumptions and really get our facts right and see what actions we can take to address diabetes. So diabetes is not just a problem for the high-income countries, but it is a challenge for low-income countries. And if I can just quote that in Kenya, in 2000, diabetes was at 183,000 people. But by 2030, this is going to be more than 3 times what it is currently. So we have every reason to be concerned.
Yes, I mean, you're saying, diabetes is growing at an absolutely exponential rate in Africa, whereby funding is not. And so you have, a problem growing not in line with the funding and the resources to help it. So I would assume that prevention and awareness is the best way to start. And in order to ask you that question, how can we really get involved in raising awareness about diabetes, Constance?
Right. So I think there are so many ways in which we can get involved. I think first of all is to highlight this as a problem, which I think this World Health Day is doing. And if we can get to a lobby and advocate with our government to increase funding for diabetes, then that can help us to increase on our health promotion activities so that we can reach more people with information. Because the current problem we have is even lack of diagnosis of diabetes. So many people have diabetes, but they don't know about it. It's only when some of them develop complications that they realize that they have diabetes. So increasing funding is number one. The second thing we can do is to organize local events on the field in our own communities and inform others about diabetes, and the ways in which they can prevent diabetes. So exercise, eating healthy, stopping smoking, all that, eating a balanced diet is key to preventing diabetes. The second thing is to encourage diagnosis and detection of diabetes by promoting routine blood or urine glucose tests, because that's the only way you can know whether you have it or not. Yeah. So if we can get people to get into the habit of actually testing, then that is key. We also need to promote treatment and care of people with diabetes already, on how they can self-manage, because while it's a big problem, it can still be managed if one already has it. So there are certain steps that people can actually take to manage themselves. So as public health practitioners, we can also be involved at this level. And continue to advocate so that diabetes can be halted.
Yes, well, thank you very much. I think, you touched upon an interesting point there with the fact that with diabetes, it can be in your system. You might not know that you have diabetes, and then when you start suffering from really heavy symptoms, by then, you've lost all that time where you could be treating and managing your disease, and you've left that to accelerate. And so only through, awareness and screening and earlier testing are you going to be able to kind of deal with what later becomes a cost and a resource issue for you. Over to Daniel. We're going to look at the case study of Ebola, and if you go to our website, Roehampton Online, you'll see both these case studies actually on the Roehampton Online page. Daniel's fight with Ebola and the work that he's done there, and Constance discussing today's World Health Day theme, so please go on there and check it out. Daniel, are you there?
Yes, I'm here.
Hi, Daniel. You've played a significant role in the fight against Ebola in Nigeria. What specialist skills and knowledge did you apply in the field to fight against Ebola? Can you please tell me a bit about your story?
Okay. Ebola came into Nigeria in July 2014, and it was really crazy because we had one person bring in the virus, and then we started having different contacts that started spreading. And by the time we were told to go and fight the disease, one of the key questions I had in my mind was that how do we interact with these people? So you have the public health department, and then you have the community. And then the question is, the virus is moving within the community, and you want to find a way to stop transmission. And so what came to my mind was, okay, how do we interact with what the community is so used to already to get them to be safe? And we had to look at social media. We had to look at the fact that a lot of people in Nigeria have mobile phones, and you want to find a way to get information across to them. You want to be able to find a way to get cases when a rumor comes up that somebody is vomiting somewhere and is becoming symptomatic. You want to be able to use the social media platform to get information to the control center and then get people there to evacuate before you have another infection. And so we had to do everything in real time. So the word here is real time. We had to think about a way to make it real time. And so we built the software then at the time to be able to follow contacts. It's more or less like contact tracing. We also built to be able to track cases and also do follow-ups for 21 days for people who became symptomatic. And then this helped us, among other interventions, to be able to follow through every single case that we were onto, and we did not lose or miss out any suspected case. And at the end of the day, we had to publish this. I mean, to tell people that, okay, this is what we were able to do during the outbreak, and then what are the limitations and what are the strengths. And the next project we came into, which I'm currently working on in Germany, is SOMAS. And SOMAS is Surveillance Outbreak and Response, Outbreak Response and Management Analysis System. It's a system that we want to build upon what we used it during the Ebola outbreak to do surveillance and to do outbreak management at the same time. So that's really the summary of how we sorted it out. So publishing it was really important because one can learn lessons from this and apply it to future outbreaks.
And how did you go? What was the process to get your work into publication? You know, I like to call this section for you, Daniel, from innovation to publication, because I know, you know, innovating and apps and data sciences is your area of expertise. But what motivated you and pushed you to be published, and who helped you with that process?
Okay. One thing I'll say here is that as an IT person, I don't give a damn, sorry to use that word, for publishing. My job was just to solve a problem and get out of there. You know, but because I've worked with a lot of public health professionals and epidemiologists who feel that publishing is very important in our line of work, and so they felt that, no, it's important for you, Daniel, to publish this. And then at the time my coursework with Roehampton was still on, and the last webinar, I remember telling the students that I had a problem in Module 1, which had to do with academic writing and all that. So I had to sort that out. And so one of the things I've learned in Roehampton is because it's an online program and you have to do a lot of writing. You have to do a lot of reading. You have to do a lot of citing and referencing and all that. So that helped me to put my thoughts together and using the Harvard referencing style to do my writing. Although most of these publishing organizations have different styles of writing and all that. But it really helped me to settle down and begin to write. So right now I've done about 4 or 5 publications as lead author and also co-authors. But I can say that it really helps me to sit down and say, okay, I have this concept. How do I go about it? And I just publish.
I think also it adds some real weight and gravitas to your work, and also, you know, when you're pushing things forward and moving from project to project, you're having these milestones and these publications allow you, to network and push things forward a bit more. It's a real, a living and breathing document that's there that shows, your achievements and the potential of what you can do when you collaborate with people in your field. Daniel, you're really on the forefront of current health practices. I want you to be our students today to be able to source your opinion as you come from such a different perspective from the general population on our program. What do you believe is the future for public health? You're talking about mobile technology, e-health. Where do you think this is going to go?
The truth is that e-health is the next level of health interventions in the health sector. The truth of the matter is that we will not deny the fact that IT has come to stay, and IT has influenced every aspect of our lives, of our being human beings, and everything has to be fast. Now, how fast and how efficient can the system be, and how do you help a current existing system to do their work efficiently? And that's where IT comes in. So health is important, where you have doctors and nurses and public health people do their stuff, but how information technology comes to play in ensuring that their work is done real time, their work is done efficiently, and their work is done on time makes them save one life. And when you save that one life, it makes a difference. So e-health has come to stay. E-health is the next level of, it's the future of health. Yeah.
I mean, you talked a lot. Key word that will come out of this webinar is real time.
Yeah.
That really makes a difference. But in terms of saving lives, is real time data, and the application that you produced to help with Ebola was giving the medical health professionals real time data on cases, right?
Yeah. And contact.
Okay,
so how it worked was, yes. I mean, just because of time, I would have been able to expound more on how it worked, but just to say that when we had issues from the field, you give health workers mobile phones to go to the field to investigate. And whatever investigation they get from the field comes into the control center real time. And if you have someone who becomes sick, and then you have an automatic reminder, automatic alert system set in place, and the health people go there to solve the problem. So you discover that if one person has been infected, because of the real-time system, it's difficult for the next person to get infected, and you stop the transmission of the chain right there. So that's why real-time is important.
Perfect. So that's the future of public health for those that are out there looking at ways to innovate within the industry. So thank you. We've lost Constance again. It's a bit of a bad phone line, so I'm just going to call her back, and my apologies. Just bear with us. Hi, Constance, are you there?
Yes, I'm here.
Lovely. So thank you very much, everyone, for just hanging with us there as we experience a few technical problems. Now, Constance, we have a lot of students that you're teaching on the course, and I believe that you're teaching the first module, leading and learning in a public health context. How does the knowledge that gained on our MPH program help to address the public health challenges in the real world? And what ways does the Roehampton MPH prepare our students for combating these real world public health problems?
Right. Thank you so much, Joe, and thank you to the audience as well. For me, it's been a real pleasure to be involved with the University of Roehampton, the MPH program specifically, and I love teaching on this course because I really feel that I'm also contributing to the knowledge economy of the world, in terms of public health. And one thing I really like about the University of Roehampton MPH program is that it really promotes critical thinking. We promote independence of our learners so that they can really confront the public health challenges. And how do we do this? We help our students to improve their communication, But, the ability to write better, the quality of writing improves with time. And the kind of work that Daniel has displayed there that is published in Clause 1 is every lecturer aspiration for their students. And so when students are coming in on their first module, my advice to them is always write like you're writing for a journal, because that's what we want. People who can actually be able to contribute to the body of knowledge in terms of public health and do it excellently. So we also build subject matter expertise in the course. So it's not just about the communication skills, but also building the subject matter in terms of public health, learning about public health financing, public health leadership, learning about how to manage health systems, and which is key. So we're not really just teaching about specific disease challenges, but we are teaching students to be able to apply the subject matter expertise to whatever disease challenge that concerns them. So be it Ebola, be it diabetes, be it HIV and AIDS, everybody in the classroom can take away something that is relevant to their content and be able to apply it. We link theory to practice in an applied way, and in such a way that the skills and knowledge gained can be applied, globally. And we improve the skills of students in planning, the development of their personal and professional development plan. So really, they look like simple things, but these are really things that are key in practice. Because even in my own work, I develop personal action plans, and I stick to them and I use them. They're a living document. So when we're learning about them in the classroom, it's not that we're doing them just to fulfill an assignment, but we're doing them because these are tools that help us in the field to be effective. Yeah. So we are helping our students to become very good time managers. We're helping them to plan themselves around their personal and professional commitments so that they can be successful.
Yes, I mean, thank you for those comments. You touched upon the personal development plan, which is an important part of the program. This is not an academic program just for bystanders, as we can see for Daniel. Daniel, is a practitioner out there, using data science and mobilizing, people through his applications. And then he had to go and do the academic part and go and study the citing and referencing and really put some time in there in order to do the publication, because both sides, as you're highlighting, Constance, are very important. It's not just the academic side, but it's the what we call pracademic side. The practitioner meets the academic, and on our courses, that's what we're doing. We're enabling people to be practitioners and to be networkers and influence in their community, and we want them to network with each other. We want you to go out and network with, with Constance, with Daniel, and other students like this, so that you can try to think about innovative solutions to the public health challenges that you're facing across the world in your regions. Constance, what kind of students are on the program? Where do they come from, and what are their backgrounds?
Oh, it's a very diverse group. They come from all over the world. I've met people from all over the world, which is very exciting, because then, the diversity increases, it makes the program more interesting. And the students also have varied backgrounds. And I think that the key thing with the Roehampton program is that the MPH is not the reserve for medical practitioners or people with a health background only. But we are starting to see that people are beginning to appreciate public health as as a discipline that anybody can also come into and make a difference. So really the interdisciplinary approach or multifactorial approach to public health. So our students have backgrounds in computer science like Daniel. Some of them have backgrounds in nursing. Some of them have backgrounds in education. Some of them have backgrounds in engineering. I've come across students with a background in engineering, health and safety. So it's really a wide array of skills and backgrounds that they're bringing onto the program. And to me, that makes the course even more rich, because we exchange experiences in ways that I wouldn't even imagine myself as somebody who's been in the field for many years. And it's always enriching. Every time I get into a classroom, I also learn something new.
Yes, I think, to use a scientific term, it's a bit of a catalyst when you have, people who are different experience from different sectors. It makes learning and understanding a quicker process. Your speed to solution is quicker, because you have people who are, have pockets of expertise in different sectors that you might not know, and then you get to meet them online. Thank you very much, Daniel and Constance, for going through our case studies, looking at the theme of World Health Day and the public health challenges that you're facing, as well as our, wonderful program and what we do to enable our students to go out there. We have our panel open now for questions, and we have some questions that have come in. We haven't read these questions before, so these are straight to you. So thank you very much, Hugo, for fielding these questions as well. So let's have a look at some of the questions that we've got. So I know that, Constance, you've answered a couple of these privately, but these are public questions that we'd like to also discuss with the rest of the participants today. With regard to diabetes, what is the most common symptom in women? We have a question today.
Oh, okay. Yes, I think in women, mostly it's... Sorry,
women and men, sorry.
Or women and men. Yeah, so the common symptoms of diabetes is usually if you have increased hunger or thirst, it's a signal. If you frequent the toilet more often to urinate, it's also one big sign. And sometimes for some people they start losing weight drastically or gaining weight without an obvious cause. So it's also one of the key symptoms. Sometimes fatigue, blurred vision, and if you have a wound that heals very slowly, that can also point to that. And some skin infections, patches of darker skin, irritability, bad breath, or reduced feeling, or the feeling of numbness in your hands or feet. And the best way to know really is that you need to get tested. So what I would encourage is if anybody's suspected or that they might have it, the best way to know is to test.
And yes, and obviously that can just be done with your GP, right? In your local GP's office. So we have another question here about data scientists, and we have another question about working globally. So I'm going to ask you that one. So let's have a look. I'm interested in working globally. How do I get connected to some of the organizations that are out there doing global work? Daniel, would you be able to answer this question? How do our students get active with global organizations? Who do they need to approach if they want to work, for example, with non-communicable diseases? What would the first steps be?
Okay. Because of time, I couldn't explain how I got into the current work that brought me to where I am today. The truth of matter is that I started out as a volunteer, and this is what happened. With all my years of experience in IT, because of this desire and passion I had, I just wanted to test out the skills I had to this new environment, and I had to start to volunteer. So what I would say to this person who has asked this question is that you go out there and just tell them you don't need to get a job yet in terms of, until I get a job with this kind of global, because I work for the U.S. Center for Disease Control. I work for Germany, where I am now. I'm still working for an international organization. But it didn't just start there. It started from a place of, how do I see myself applying my skills? Not about getting a job, but volunteering. So I actually volunteered for a while before they said, hey, Tom, you just have to come in. And I got in, and it's just been, going up all the way. So I would advise you to go and volunteer. Don't bother about whether they're going to pay you or not. But that's where you can start. The truth is, especially with United Nations jobs as a global example, it's difficult for you to just come from outside. You just need to start from a point where you can just show what you have, and it starts from the place of internship and volunteering. Constance is a good person to let you know that it's easy for you to, like, you can go join her if you're in her country. You go join her when she goes out for such campaigns, when she goes to the villages. It starts from there, and then from there, before you know it, you actually get integrated into the system.
Okay, we have another question for you, Daniel. Someone who you may have worked with before. Hello, Daniel. My name is Namandi Usifo. First of all, I must say congratulations once again on your most recent appointment as a data scientist. Also tell you that your former colleagues at the Center for Disease Control and Prevention National Stop Transmission of Polio program in Nigeria myself included, really missed the wealth of knowledge you brought to the table. So my question relates to data use. Having spent some time as yeah, it's nice, huh? Having spent some time as a data scientist in Germany, comparing data collection, analysis, and use for action in Germany to that of Nigeria and other developing countries, in what ways do you think the developing countries are doing well, and what are the areas that need improvement, especially in Nigeria, so when it comes to data collection and action?
Okay. I actually know the person you're talking about. That's why I was laughing. What I would say is that, and I'm not going to be what's the word now? It's not because Nigeria is my country, but I want to say that a lot of young people in my country are very proactive. They want to learn, and they have this passion. The problem is sometimes they're not given the opportunity. And so you have a large mass of people who have gone to school to study different stuff, and then it's difficult for them to get a job, you know. And narrowing the perspective or the scope to health, to answer this question, I would say that a lot is being taught online, on data collection, on the data management, on how to use IT to influence. Simple tools like Excel can go a long way, you know, to help your work. And when people sit down and say, I'm waiting for that job to come from somewhere, you have to start with what you have on your hand or in your hand, and then from there you can take a big leap. So I would just advise to keep building yourself. Constance talked about capacity building, you know. Keep building yourself. And one of the best way for you to build yourself is to train others. And that's one way I've learned. And you know, right, because I was with NSTOP, the National Stop Transmission of Polio. And one of the things that I did that helped me as a person was to transfer the wealth of knowledge I have to other people coming up, you know, behind me. And that's one way to actually train yourself and build your own capacity. Constance has been training for a while, so she can tell you that. So that's my advice. There's not a lot of time for me to go deep into what things you need to do, but just try to build yourself. Know that success is not a destination, but success is a journey. It's every step of the way is a journey. And when you get successful, it's not your destination, but it's actually the next phase of your journey.
Thank you. I think it ties nicely into our program. It's not, you know, just to pick the piece of paper up at the end. It's the learning experience throughout the program, that, you know, the journey that allows you to really, you know, take benefit and figure out how you can contribute. I'm just going to bring Constance back in again because she's dropped off the line, and we're just going to wrap up our presentation, but I do want to say goodbye to her, so I miss her. So I'll give her a quick call, and I do apologize for the inconvenience. Just bear with me.
Okay.
Hi, Constance.
Hi.
All right. So we're just rounding up our presentation at the moment. So thank you very, very much, Daniel, and thank you very much, Constance, to taking some of those questions. If we didn't have the opportunity to answer those questions in the session today, we do apologize, but our session is booked for an hour, and we know a lot of you are busy going out there and actually tackling those problems, and you need time to do that. So thank you very much. I'd like to highlight our wonderful Refer a Friend program that we have at Roehampton. We're extremely proud that we have 1 in 5 people at the university is actually referred by a friend. So it's great word of mouth that we have about our program. We're extremely proud of that, and now we're starting to see some really great graduation stories and people out there who are really using the program for their own benefit, just like Daniel is. as well. Daniel, I'd like to ask you one last question today in conclusion of the session. Daniel, how are you managing the research program? How are you managing your research project within your work schedule? So how do you manage your time?
Okay. For you guys who are going to start in Roehampton, one of the things I'll ask you is to do your work should be related to your studies. I won't lie to you, it's not easy. So don't say, okay, I'm working in so place and this is my line of work. And then, for instance, for someone who is still in the IT world and working and wants to do public health, and he's not in that field in terms of a job, I will tell you that it's going to be very difficult because it's going to be not easy. It's not going to be easy for you to blend the two. So my advice to you is what you're interested in doing, then you study in the same line. So what happens is that you're able to blend your work with your studies. And that's what I've been doing that has brought me to where I am today. I'm able to look at what I'm studying in Roehampton and then apply it to what I'm doing. And so it's not about living, work, and going to school, but it's about integrating both aspects together that brings out the result in my workplace as well as get me to the finishing line.
Thank you very, very much for that, Daniel. And Constance, what piece of advice would you give to someone who's just about to start the program, just about to go into the first module that you teach? What is the one piece of advice you'd give to them if they've never studied online before?
I can only say, Joe, that they can do it. I say they can do it because many other students have walked that journey and they've succeeded. So, and the only way to know if you can manage it is if you try. So the best way to do it is to just go in and try. You can give it your best, shot. You can make it. So really, if you're thinking about it, try it and see how it works. But I can assure you it will be a worthwhile experience. It's always such a joy when I hear back from students and they say, oh, I'm using these skills in my work, and people are starting to see a difference in my work. And I say, wow, that's wonderful. Because more than just getting the qualification, I like it when students actually take something and apply it into their lives, into their work, and make a difference.
Lovely. Now, that was for our prospective students who may not studied online before, but we have a lot of students also in the room who are currently studying. What tip, Constance, and this is the last question I'll ask you today, would you give to a student who may not have an idea what direction to go with their research project? How would you advise them for that very important phase of their program?
I think it's important to speak to the faculty, get some advice, but also when you're doing a research project, for me I find it's much more easier to sustain interest if you do something that comes naturally in terms of interest. So if you are into nutrition and you really love things around nutrition, so maybe your research project should be around that, because then it's something that comes naturally for you. So it's really good to look around for those small little cues around you in areas where you won't really struggle so much in terms of getting information or data, but also in terms of sustaining your interest. So, but get talking to your faculty, they'll also help you to think about the topics. We're here to help.
Thank you very much. So stay super, stay healthy, and beat diabetes, everyone. Thank you very much, Constance. Thank you very much, Daniel. Do apologize for some of the problems we had with the phone line, but we overcame those challenges just like you guys do in the field in order to make things better and push things forward. So thank you very much, and thank you to all attendees today, this University of Roehampton online webinar. Thank you very much. Goodbye.
You're welcome.
It's been a pleasure. Goodbye.
Bye.
Bye.